Our next speaker is Dr. Julio Perez. Dr. Perez is a clinical psychologist with a Ph.D. in neuroscience and behavior from the Institute of Psychology, University of São Paulo. He is a researcher member of the Program for Health, Spirituality, and Religiosity, PROSER, at the Psychiatric Institute, University of São Paulo School of Medicine. Dr. Perez is author of the book, Overcoming Trauma, What Psychology, Neuroscience, and Spirituality Teach. Please welcome Dr. Julio Perez.
Thank you, Claudio, for this nice, inspiring lecture from the bottom of my heart. And I would say the same thing for Jeff. Where's Jeff here? Here. Thank you, and Gary. It's indeed a pleasure being here again. And I thank you all, audience. My lecture today will be about a recent publication in late February this year. So I will cover some main topics. Let me have the right time here. Okay. But I invite you all interested in download this publication in my website for Portuguese speakers, julioperez.com.br. Would be very easy. In case you are interested to get in deep about some topics, especially the ones I wouldn't be able to cover in this 45 minutes lecture. So I will necessarily speak about death, moreover, life beyond death. And I want to begin bringing this interesting publication, this interesting statement that Liza Miller published in New York Times 2010. Interest in reincarnation is on the rise, and its purveyors are not monks or theologians, but therapists. Why is that? How could you answer this question? In this demographic line of data, I will pose two tiny questions that make a great difference in the way people can relate to traumatic events. Do we have a soul? Do you believe in life after death? So, according to World Valor Survey, the majority of population, of the world population, believe that we have a soul and in life after death. Considering this demographic data, it's very important, and we are justified to consider the reincarnation belief in psychotherapeutic scope. If you are talking about reincarnation belief system alone, 28% of the world population believes in reincarnation. 26% of the Europe population as well, and 27% of US population believes in reincarnation. In Brazil, according to Datafolha 2007, just 1% do not believe in the existence of God, 21% do not believe in life after death, and 44% do not believe in reincarnation. That means the majority of Brazilian population believes in reincarnation. So only 7% of the population have no religion in Brazil. That's why knowledge and respect for the belief system of the patient contributes toward their acceptance of the psychotherapy and to get better results from the treatment, according to Razali, to Sperry, and many other clinical experiences. I would add a brief discussion about personality. Nowadays, the science mainstream consider that personal experience and genetic predisposition are the only contributors in the formation of personality. Would you think so? It doesn't make sense to me. For instance, among many other cases, the encephalic twins and Siamese twins showed different personality traits since early childhood. Early childhood, I mean by 6 months, 1 year old, 2 years old. And we're supposed to expect at least some similarity in personality traits once the genetic background is exactly the same and experiences are very similar. So this is not the case. They showed since early childhood very different traits of personality. This, among others, are challenging example of the hypothesis that the interaction of genetic and environmental factors are exclusive in building personality. We have now many scientific publications about reincarnation, and many authors would call reincarnation as a third element. So that makes sense to me. We are unique, all of we. And despite our genetic background and ambience experiences, we may carry out from the past, from the other lives, some traits, some gifts, some behaviors as well, or even some phobias, some symptoms from a remote past. As a clinical and a neuroscientist, I would add as well a brief point concerning neuroimaging studies about religious and spiritual experiences. We have good studies so far, and I would highlight here the neurocorrelates of mystical experience in Carmelite nuns conducted by Mario Borregar, Montreal University, and colleagues. And he and colleagues compare mystical state, remember and relive the most intense mystical experience ever felt in their lives, with a control state and a second counter baseline state, like a normal restful state. And the results suggest that mystical, or even considering other studies, spiritual, religious experiences are mediated by several brain regions and systems. So the God spot theory is disproved. We have many regions and systems involved in such type of experiences. Concerning neurocorrelates of religious experience, I like very much the Azari study. More than their findings of the study, the neurocorrelates, I would highlight here the discussion. religious experience may be a cognitive process which nonetheless feels immediate. What does mean this discussion? When you bring all together as a religious frame to relate with traumatic events, you can see other possibilities, especially about learning lessons from these traumatic events. This is pretty much related to reincarnation. How can I deal with a tremendous traumatic event without a frame, without a cognitive, resilient frame that religiousness and spirituality may naturally influence our way to look these traumatic experiences? So the question is, would be possible the convergence between psychotherapy and spirituality? I think so, and that's what I'm here for, to tell something about this convergence. In this paper, Should Psychotherapy Consider Reincarnation?, I picked some interesting studies which compare cognitive standard behavior versus cognitive religious approaches used by religious and non-religious therapists to treat depression or anxiety disorders patients. According to McCullough and Probst, the possibility of using a religious approach with religious patients is probably more a question of a patient preference than differential effectiveness. According to Akhzar and Razali, psychotherapy with a religious approach showed quicker initial improvement over 3 months than psychotherapy without religious guidance. And I like very much this statement of Prochaska and Mayston. They are very similar. Patients, rather than therapists, are the agents of healing. This is a very important point here. We as therapists, we're supposed to see the intrinsic forces, the intrinsic abilities of our patients so they can empower these tools to overcome their difficulties. So should psychotherapy consider reincarnation? Yes, indeed, in my opinion. And I would like to pose this question and bear your answer in mind so you can compare your answer at the end of my lecture. It's very important to have a structure to approach this question in an ethical way with patients. So the first specific guidelines for professionals, I will discuss 7 brief questions. Of course, if a patient answered no for one of them, you wouldn't follow the next questions. Is religion or spirituality important to you? Do you believe in reincarnation? Would you like me to address this theme with you? And for sure, if he says, yes, I would like to talk about this theme, then you go further. What does reincarnation mean to you? This is quite important. Clarify the meaning of reincarnation of the patient so we can develop a clear conversation concerning the meaning of reincarnation. Does reincarnation influence the way you look to your problem, or the way you think about coping with them? 6, do you have a reincarnation-related supposition that explains the causes, the roots of your present suffering? Based on that, what would be your personal challenge to overcome the complaint for which you have sought psychotherapy? So these are the first specific guidelines for professionals. And I would like to share others guidelines that may help a lot, an ethical way to approach this theme with patients. First, prefer asking how to asking why. How allows for the patient's understanding of the process, whereas why may presume hostile intent or distrust of belief on the part of the professional. Do not pretend to have all the answers for the patient and favor the possibility of their internally pursuing a state of relaxation and self-perceptions of thoughts, images, and feelings potentially related to the root of their suffering. So the unconscious mind of the patient has the answers. You, as a therapist, you don't need to give and to know how to do it, and to teach how to do it, like a top-down relationship. Ask questions that help the patient maximize their personal resources and beliefs to overcome suffering, and avoid questions based on personal curiosity rather related to the patient's psychotherapeutic development. Beware of explanation based on suffering from memories of supposed past life, encouraging victimization instead of resilience. Self-pity, for instance, does not help a patient improvement. Professionals may tell the patient, if that information may reach them, this is because they may learn lessons from the past to improve their present life. This is a very important point here. This is all about learn lessons from the past to enhance, to improve the present life. Some people may find that their beliefs in reincarnation are more harmful than helpful for improving a present condition, and may mistakenly associate the concept of karma with burden or guilty. For instance, I deserve to suffer because I did something very serious, very bad in other lives. A point worth noting is that karma originally meant attitude in Sanskrit, and that once the attitude is altered, karma too is modified. We have such dynamic process of changing, and our psychological dynamics is very fast. In terms of neurophysiological functioning, we take advantage of this psychological dynamics so we can restructuring, we can rebuild our belief system concerning the past traumatic event. Avoid treating borderline patients who believe that they are a past life personality without proper use of medication. Identification with a supposed past personality can cause disintegration of the ego and prompt psychotic episodes. So professionals must take precautions with psychotic patients to avoid expanding their psychopathologies. This is another very important point here. Conduct, at final, a respect and sensitive psychological interview on belief in reincarnation in order to enhance coping strategies based on developing character and virtue in accordance with the central purpose of reincarnation. This is quite interesting because we have a great literature about traumatic growth. And this literature teaches us that the strength of character and virtue is significantly related with overcoming traumatic events. According to Post and Lomax, there are some ethical observations worthy of attention, and I would like to share with you now. First one, the ability to inquire about the patient's religious and spiritual life is an important element of psychotherapeutic competence. So, of psychotherapeutic competence. Therapists must do that. Second, asking about patients' religious and spiritual lives frequently reveals data that may be extremely important for them in coping with difficulties. The process of inquiry on this domain should be respectful. There is significant potential for ethical faults when a therapist exaggerates personal convictions and abandons the principle of neutrality. So I will show some concrete data about memory regression therapy that we developed in Brazil. In early 1980s, Doutora Maria Júlia Prieto Pérez developed what we call now Terapia Reestruturativa Vivencial Pérez. I will show you a study that we investigate the profile of 610 patients submitted to memory regression therapy. Who are the people who search this type of psychotherapy? So in this study, we used a sequential order from 1996 to 2002. Sorry. The therapeutic approach was Terapia Regressiva Vivencial Pérez. 3 therapists get involved, and each one saw 28 patients per year. And we applied a follow-up from 1 to 2 years. The main goal of this memory regression therapy is to integrate symptoms, sensory and emotional fragments into a story. And once the patient reaches the story with a resilient frame, he's able to change the story, the traumatic story, in order to learn lessons from the past. So in terms of age line, the average was 37.5 years old. Gender, 60% female and 40% male. Once I was showing this data, and in audience someone said, I knew women have more problem than men. So this is not the case, actually. Women search for psychotherapy more than men. That it's quite good. Marital status, 43% single, 34% married. Education, this sample was quite educated in terms of degree, professional occupation, as you can see here, 38% from humanities, 21 from healthy, biology, scope. Religion, that's interesting. In Brazil, 34% was Catholic, 27 Spiritists, and 25% spiritualists. So this type of regression therapy is not only to people who believe in reincarnation. That's quite interesting. I will discuss this later. This is a very important data. Therapies previous to terapia regressiva vivencial Pérez was very, very high. For instance, 65% searched before regression therapy, conventional psychotherapy like cognitive therapy, psychoanalysis, and so on. 27 searched for alternative therapy, and 8% psychiatry. Complaints. Most of patients in this sample had interpersonal difficulties in relationships, as well as anxiety disorders, like specific phobias or even PTSD, post-traumatic stress disorders, symptoms. And the average number of sessions was 22 sessions, about 6 months of treatment. Types of therapeutic experiences. This is important. I said a couple of minutes ago that I would discuss this. 38% brought some supposed past life traumatic events. However, 39% brought in their regression experiences traumatic events for present life. So once the patient get contact with this inner unconscious mind, the unconscious run the process. You cannot guarantee that a patient goes to a supposed previous life traumatic event. Verifiable spontaneous data of this 38%, which I showed here, as a supposed previous life traumatic event. This is quite interesting. They are very rare cases. So, even though they are rare, we must study these cases. They are quite interesting. Once you have name, dates, place, events, specific situations, or historic period which arise spontaneously. So only 2% gave us accurate data from past life memories. 77% inaccurate data, and 2%, sorry, and yes, and no, I invert, it's the opposite, sorry. Accurate data, 2%, inaccurate data, 21%, and lack of data, 77%. So once the patient brings spontaneously name, dates, and verifiable spontaneous data, we're supposed to get it into a deep investigation. And I will present later on a case of one of our patients who gave spontaneously verifiable spontaneous data. Level of relaxation, 74% reported a deep level of relaxation. remission of symptoms and complaints. 64% reported total remission of symptoms. Compared to traditional approaches in psychotherapy, this is a significant level of remission symptoms. 64% is quite high level in psychotherapeutic wise. 27% partial remission of symptoms, and 9%, including patients who gave up the process, showed null remission of symptoms. Believe in reincarnation. As you can see here, after psychotherapy, we had a significant increase in total belief in reincarnation from 42% to 71%. And why is that? This is very interesting. In this doctoral thesis of Regis Cavini, we investigated autonomic and neuroendocrine response during memory regression therapy. And as you can see in this square marked V, the regression experience itself, the cortisol, a hormone related to stress, increased compared to the baseline in black. At the end of the process, at the session, the level gets lower than the baseline. The same happened to adrenaline during the regression experience. As you can see here, a peak of adrenaline, so the emotional content is genuine. It's really real to the patient. That's why you saw in last slide the increase concerning the total belief in reincarnation after the experience. And as you can see at the end of the session, the adrenaline is lower than the baseline, the control line in black. And it's very often to hear some statements like, I feel relieved, I feel light after the regression session. We did as well an electroencephalographic study. And as you can see, we have the prevalence of alpha data in occipital lobes during relaxation. That seems to be a gate to reach this content from unconscious mind. And during the regression session, we have delta waves in frontal lobes. In literature, we can find experts in meditation exactly with this type of prevalence of waves, and beta waves at the occipital lobe. So beta is pretty much related to visual state. The patient gets into altered state of consciousness without leaving their awareness, so the patient can establish the relationship between the content arise and the complaint that is working on this session. So, summarizing, this is some of the points I covered here. I will skip this. And it's important to say that religiousness and spirituality is very frequent in human history despite periods of cultures. So we must consider these belief systems. And the question is, should we treat psychopathology simply as brain illness? So I would invite you to to read these two papers and the book Trauma e Superação that I will discuss in a deep way this question. Schultz, Ross and colleagues argue that the difficulty integrating this theme with psychotherapy resides in certain factors such as the traditional approach taken in psychotherapy schools. Second, spirituality and life after death are beyond the sphere of investigation and knowledge that I absolutely disagree. We can study the subject, that's for sure, with rigor, with good methods. The absence of supervision and training programs, I agree with this, and that's why we offer a training program to combine reincarnation and psychotherapy by internet in a distance way. So this is quite important to develop in this field. And educators and professionals feeling uncomfortable about working with spiritual and religious theme. So far. So reincarnation gives us a possible explanation for behavior not produced or imitated within the family context, like some disorders and disadaptive behaviors, such specific phobias and symptoms of PTSD are difficult to be explained only by genetic and environmental influence. There are many lines of research in reincarnation scope. And as you can see, regression therapy is one of them. And we can research patients with spontaneous data. That's what I would like to show to conclude my lecture today. I will show you a case of a specific phobia that is named anxiety disorder. The complaint was unreasonable fear of explosion present since early childhood. During the anamnesis, around age 11, she started to have recurrent intrusive thoughts of explosions and catastrophes. The possibilities of an explosion, even harmless ones like fireworks, caused fear and extreme affliction. This is very interesting. She was able to recognize that fear and avoidance was excessive and unreasonable, but she could not prevent them. This is a typical specific phobia case. Nevertheless, there was no history of an etiology event, no memory of exposure to a traumatic experience that justify fear and anxiety in relation to explosions, or even a possibility of this. So, the theme worked in memory regression therapy was fear of explosion. And let's see what patients brought spontaneously. Early morning, 20th of May 1941. I'm Greek, 20 years old. I love this place, Suda Bay. She reported suddenly many enemy planes reached the bay and heavy bombing began. I can hear many soldiers screaming, crying out, German Stuka, German Stuka. First, I tried to hit the planes using a machine gun, beside the Australian soldiers, but as had no success, I just tried to survive running to the shelter. Pay attention. I tried to hit the planes using a machine gun. There are many Stukas. They can shoot from behind. That's quite interesting. They can shoot from behind. 3 bombs, so many bombs. The Australian soldiers are shooting against the German airplanes. They are in defending. She reports suddenly a terrible noise, and afterwards an explosion of the bomb occurred very close to me that caused my death. And this contains our experience in very high level of emotion expression. I can see the cross printed on the plane. Look, right now, she's already dead, and the spirit goes somewhere else and continues to talk about, I'm out of my body, the bombing finished, and I'm seeing many, many parachutes. They will be invade the bay. And I will show some minor points here confirmed. Suda Bay exists, in fact, it's in Crete. Sorry, my ignorance, but I didn't know that. Even the patient didn't. Stukas attack Suda on the morning of 20th May 1941. This is original photograph of this attack. German Stuka bomber, as you can see, they have a gun from behind, and she could see the cross printed in these planes. New Zealanders, Australian, and British units were, in fact, in support of Crete civilians. And civilians were engaged in this war. As you remember, she tried to use a gunshot without success. This is an old German map of the war strategy in the Crete Island, exactly the Suda Bay. The parachutes, after the bombing, the parachutes in the between life period, she was able to see great number of parachutes. The most traumatic moment was bomb exploded and patient experienced sensation of impotence, inevitable destruction, and death due to explosion. The decision, the imprint in unconscious mind or spiritual mind was, explosions cause destructions and death. I have to fear and avoid them. The cognitive redecision, I'm careful about explosion and feel calm. So, at the end of the process, phobia-related symptoms decreased gradually by the end of the treatment, and patient did not fulfill diagnostic criteria for a specific phobia. Conclusion. I'd like to pose the same question. Should we consider reincarnation in the scope of psychotherapy? Psychotherapy must therefore take note of the significant group of reincarnationists around the world, regardless of the reasons that lead them to believe in reincarnation. There are many reasons. Could be vestige of the pre-Christian era, influence of Western and Asian scriptures, philosophies, finding a plausible explanation for issues not explained in other ways, experiences and personal memories of previous life, like recurrent dreams or nightmares. Cognitive framework for coping with the grief of the loss of loved ones. So therapists must pose certain questions and guidelines in the processing of overcoming is to take place. Like, considering your past life memories, what challenges must you overcome in this current life? Yes, you can reach lessons from the past to overcome your challenges in present life. What lessons may be gained from this past experience for you to lead a better life in the present? Compose a sentence, finally, or a cognitive synthesis that helps you to apply what you have learned in practice in your day-to-day life in order to enhance your present life. So, this is the main point here. We can open our minds to identify the roots of some symptoms not explained by present life events. And the very point here is to learn lessons from the past, exactly to enhance your present life. Thank you very much.